Hey guys, Dr. Dobson, and in this one we're going to be doing a couple of class 5 dental restorations. This is a patient that came in with a couple of cavities along the gum line, and so we're going to fix them with fillings. And the first thing we're going to do is get a couple of millimeters of access to clean, healthy tooth structure using a electrocautery tip. You'd have an option of using cord, but in cases where I suspect it's going to go subgingival, I prefer to have direct visual access to the clean margin by ablating some gum tissue, just because I find it to be a little bit more predictable at getting a nice gingival margin. And once we have good access, we're going to begin removing the tooth decay with a high-speed round diamond burr and just doing our outline form on the first premolar there. And once we have our outline form, then we're going to go in with a small round carbide burr on a slow speed handpiece, and you can see that the tooth decay just kind of peels away. And I like to use the small round carbide for caries removal, because I find that I can just use tactile pressure to determine when we're back on healthy dentin, as opposed to using a caries indicator. And then we're going to move on to the second premolar, and we'll actually notice that the decay is actually quite superficial. It really doesn't go that deep into the tooth. And actually, when we use our slow speed here, we'll see that there isn't really any soft tooth tissue that peels away, and that little bit of decalcification on the distal is going to go all the way around the tooth. So you could drill that whole thing out and do a class 2 if you wanted to, but the bite wing didn't show any evidence of decay into dentin, and so that's where we're just going to stop our margin, and that's going to perform fine. And then we'll start to surface treat the preps with a 5-second phosphoric acid etch, and then rinse it off thoroughly, and then dry the tooth mostly before applying our restorative material, which is going to be a Fuji2 Light Cure resin modified glass ionomer. Going to dry the surfaces mostly, and then I'll typically overfill the preps. I'm going to fill both of them up, and then kind of pack in the material with a moist cotton pellet to ensure that the margins have restorative material intimately adapted to them. And then once we've done that, we're going to cure the material with just going to remove that little bridge there. And then we're going to cure the material with our Velo Grande a few times, and then we'll be ready to remove the excess material. And we'll do that with a carbide flame on a high speed, and this takes some time, just kind of gingerly going around all the margins until we have a good flush surface. And once we've done that for the 4, we'll do the same thing for the 5. And then that's pretty much going to be it. We'll coat the material with a coating agent called Equia Coat that I use on Fuji2 as well, because the stuff can kind of wash out, and the coating agent helps to prevent that from happening. This is only a material that I use for non-load bearing areas, and I find that it works great. So we'll coat it and then cure that. And then gums, well, dismiss the patient. Gums are going to be tender for a couple of days. This case is actually part of a bunch of longer series. You can see there's bleeding in the back of the mouth. We actually did an extraction and a couple other restorations there, and I can link those videos in the description if anybody wants to check those out. We did a bridge, crowns, a few more class 5 restorations, and then these ones in the quad 4 we did as well, and those are posted in the description if you're curious.